Hello and welcome back to the American Heart Association's Red Chair series sponsored by Rochester Regional Health. I'm Christy Smorrell with the American Heart Association. Today we're going to talk about a stage in a woman's life that can create an increased risk for heart disease. I'm here with Dr. Elizabeth Bostock, Executive Medical Director of OBGYN and Women's Health with Rochester Regional Health. Dr. Bostock, maternal health is so important for women's health. What is it about pregnancy that can create an increased risk for heart disease?
Pregnancy is basically a stress test for the heart for women. Fluid volume and blood volume increase by about 50% in order to support the growth of this baby from being a single cell to the fully formed 8-pound baby that comes out. That takes a lot of effort on the part of the heart. There's a lot more work to be done to support 2 individuals rather than 1. Certainly, pre-existing conditions like hypertensive disorders, diabetes, preeclampsia can all make this even more stressful and worse for the heart. So the heart just has to do a lot, and it's a very stressful situation.
And after all those months of increased risk, you then have childbirth. So what happens in childbirth itself that can cause more problems too?
So childbirth, on top of all of that, is like you've been training for 10 months and then you run an ultra marathon. Right? You have the effort and blood flow that needs to go to the muscles to sustain that effort. This occurs over often a long period of time. Heart rate is up and down, blood pressure is up and down. And so the heart has to do a lot of work to just sustain that entire process. And then at the end of it, you have a baby and the placenta comes out and blood volume suddenly drops, hormones suddenly change. And now the heart is working in a very different condition. So a healthy heart can adapt to all of these dynamic changes quickly. One that's on edge or has a lot of issues to begin with may have more problems. And so this can be a very dangerous time for women.
Heart disease is actually the #1 killer of new moms. So what should women be on the lookout for in the postpartum period and maybe even beyond?
So in the postpartum period, then that first year after you have a baby, be on the lookout for signs and symptoms that are different than what you might normally experience. Now, I'm going to be honest, no woman goes back to feeling the way she did before pregnancy, right after pregnancy. But if you are feeling tired and that's not getting better, you're having pain in one of your shoulders, your chest, shortness of breath that you can't really explain, swelling in your feet, your legs, your hands that you can't really explain, then communication with a healthcare provider is always going to be the best choice to have that evaluated.
That's great advice. Now we know that there are health disparities in maternal health outcomes. Can you tell me a little bit about what Black and brown women face?
Black and brown women certainly face increased risk from both pregnancy and childbirth in the postpartum period. And so we know that one of the things that we can do to intervene around this is increase awareness and communication between healthcare providers and Black and brown women. Another thing that can be really useful in this situation are doulas, who are basically informed patient advocates to help in that communication process.
Thank you so much, Dr. Bostock. This has been a great conversation, and stay tuned for more from the Red Chair series.